Today, we will be discussing the prevention and regulation of diabetes, the body's regulation of blood, insulin resistance, and healthy eating and lifestyle. First, we will discuss the body's regulation of blood glucose through insulin. Insulin is a natural hormone produced by your pancreas that controls how your body uses and stores blood sugar. When you eat, the food travels down into your stomach and small intestines, where it is broken down into nutrients that include glucose. This causes your blood sugar to rise, which is when your pancreas releases insulin to regulate your blood sugar levels. Insulin helps the liver take in excess glucose from the bloodstream. If your body has enough energy, the liver stores the glucose you don't need right away so that it can be stored and used as energy at a later point. Now we will talk about the body's regulation of blood sugar levels through glucagon. Glucagon, just like insulin, is a hormone produced by the pancreas to help regulate blood glucose levels. Glucagon functions in the opposite way of insulin. When your blood glucose levels fall too low, also known as hypoglycemia, the alpha cells in your pancreas release glucagon. Glucagon tells the liver to convert stored glucose, also known as glycogen, into an unusable form and then release it into the bloodstream. This process is known as glycogenolysis. Glucagon can also prevent your liver from taking in and storing glucose so that more glucose stays in your blood.
So what is diabetes? Diabetes is a disease related to the body's ability to use or produce insulin. Although there are various types of diabetes such as type 1 diabetes, gestational diabetes, type 3C diabetes, and so on. The most common form is type 2 diabetes, with approximately 90 to 95% of people with diabetes having this specific type. Symptoms include fatigue, increased hunger, thirst, and weight loss. Type 2 diabetes in particular occurs when blood glucose levels are persistently high, with the main cause being insulin resistance, in which the pancreas continues to produce insulin, but the body cannot use it efficiently. Insulin resistance has been linked to the regular consumption of simple sugars, which are found in foods such as fruits, candy, and baked goods. Consuming simple sugars on a regular basis can cause your blood sugar to spike, which then leads to an increase in insulin secretion. However, this insulin spike also increases the size of visceral fat cells, or the fat surrounding the abdominal organs, at an alarming rate. In response, the fat cells release cytokine, which increases inflammation and damages the receptors, such that insulin can no longer bind to it properly. Thus, insulin resistance. Since insulin is not doing its job properly, cells are no longer getting enough glucose. So the body initiates the breakdown of muscle and fat to compensate. As a result, the liver receives an alarming influx of fatty acids. And so the liver begins resisting insulin as well. The combined resistance of insulin in the fat cells and the liver is called systemic insulin resistance.
Glycemic index and glycemic load and their effect on acute spike in blood sugar. The glycemic index represents the speed of rise in blood sugar after consuming carbohydrates. Glycemic load accounts for carbohydrates, proteins, and fats in a meal, which will moderate the effects of blood sugar. According to a study, foods such as bread, cereal, and rice have a high GL and cause a rapid spike in blood sugar.
According to Viet et al., foods such as fruits, vegetables, pasta, and dairy products cause a gradual increase in blood glucose and are healthier for consumption.
Consumption of food with high G and high GL causes an acute spike in blood sugar. In turn, the pancreas releases insulin and blood glucose goes back to normal. Over time, consumption of the G diet leads to insulin resistance and type 2 diabetes. According to a study by Sierra et al. 2020, people with high BMI who continuously consume a diet high in G can exacerbate insulin resistance and have an increased risk of coronary heart disease. It is recommended that people eat foods containing high amounts of healthy fats, and protein and fiber will interfere with glycemic index and lower glycemic load. Today, many drugs have been developed to treat type 2 diabetes. GLP-1 agonists have been a popular pharmaceutical recently due to their effectiveness at inducing weight loss as a side effect. GLP-1 drugs increase the response of insulin as well as reduce release of glucagon. GLP-1 drugs are agonists, which means they mimic the structure of a biological ligand and bind to its receptor, stimulating a response. GLP-1 stimulates the release of insulin and inhibits glucagon, thus mitigating the effects of high blood sugar experienced by type 2 diabetes patients. Common GLP-1 drugs today include Ozempic, Trulicity, and Mounjaro. These drugs are mostly effective, however share common side effects such as vomiting, indigestion, and nausea. More advanced side effects such as pancreatitis and GI tumors have been reported but are unlikely. Lastly, we will talk about how to maintain healthy habits. Preventing diabetes involves maintaining a healthy lifestyle, including a diet rich in fruits, vegetables, nuts, and seeds, commonly found in the Mediterranean or DASH diet. A 2020 research by Karatzi suggests replacing processed meat protein with plant protein. Additionally, avoiding high fructose corn syrup is recommended due to its negative long-term effects such as insulin resistance or fatty liver. Researchers have proved that incorporating progressive aerobic and resistance exercises has the most effect on reducing type 2. Resistance exercise works on body composition, lowering the total body fat, improving blood lipid profile and blood pressure, and improving glucose homeostasis. Engaging in resistance exercises 2 to 3 times per week is recommended to optimize muscle strength.
Thanks for watching.